Hello, everyone, and welcome, and thank you for tuning in to Health Leaders, the place for peer-sourced and solution-focused insights for healthcare executives. My name is G. Hatfield, and I'm the nursing editor for Health Leaders. Today, we are speaking with Jason Schwartz, who is the Director of Outreach at the National Council of State Boards of Nursing, also known as the NCSBN, and Matt Sterzinger, who is the Director of Information Technology at NCSBN, about the realities of the NCSBN ID number and all of its applicabilities. So, hi, Jason, Matt, how are you?
Good morning.
Uh,
Glad to be
doing,
here.
yeah, doing well,
Yeah,
Gene. Thank you.
yeah, thanks for joining me. So, throughout nursing, obviously, we deal with a lot of workforce issues and, career opportunities, and nurses are constantly moving around and advancing in their careers. So, I wanted to ask both of you to tell me a little bit more about the NCSBN ID number and who is it assigned to, if Matt, you want to start.
Sure. So the NCSBN ID is a unique nurse identifier. It is
Hmm.
a number that all licensed nurses have for life, and it's used exclusively within nursing. It's
Hmm.
issued automatically by us, by NCSBN, during
Hmm.
the NCLEX examination process. So, the way nursing works, typically a nurse will go to a nursing education program, they'll graduate from that program, they'll take the NCLEX exam, and then after the exam, they're licensed by a state board of nursing, and then they can begin their career as a nurse. So it's during that examination process where we actually assign the NCSBN ID, so it's at the entry point of a
Hmm.
nurse into the field of nursing, and it stays with them throughout their entire career.
Absolutely. And Jason, if you want to tell me more, what information is attached to the ID number?
Yeah, fantastic. So the information that's attached really has a lot to do with who the users are, but let me give just a few examples. So, for example, with the NCSBN ID, the nurse has just one, and it's theirs for life. The nurse may have licenses in multiple states or within a single jurisdiction or state. They may have different nursing licenses. They may be a licensed vocational nurse, but also a registered nurse. They
Hmm.
may have APRN licenses. So, automatically, through our work with the state boards, all of their different nursing licenses across jurisdictions and across license types are automatically linked to the NCSBN ID. Now, from there, educational institutions, employers, etc., if they're using NCSBN ID, have the power then to attach even more. It could be continuing ed, professional development hours. It could be the actual work that they're doing in the clinical setting. It could be the career pathways that they've chosen. So it's really just a starting point for attaching information. But first and foremost, all of their licensure history,
Hmm.
disciplinary history is all there through the state boards.
Absolutely. And Matt, I want to pick your brain about this since you're the information technology director. Is there a centralized database where this information lives? Is it private? What does the kind of technological aspect of this look like?
Absolutely. So, one of the products and programs and services that we have here at NCSBN is a product called Nurses, NURSYS, available at nurses.com. It's the
Hmm.
only national database of nurse license and disciplinary information. So, as Jason alluded to earlier, um, we have data sharing agreements with our membership with the state boards of nursing, and they all contribute their license and discipline information to this database. Um,
Hmm.
as a result of that, we're able to take all that license information and tie it together with one individual and assign that unique nurse identifier. So that nurses database, the National License and Discipline Database, is where the NCSBN ID is currently housed. Now, the question of privacy is an interesting one. The NCSBN ID itself is public. There is a subset of license and disciplinary information which is
Hmm.
considered part of the public record. You can go to a state board of nursing website and you can look up a nurse license. You can go to the nurse's website and you can see all of the licenses that nurse has across all the states. And then you can view the NCSBN ID there.
Hmm.
Um, in terms of privacy, I think the best analogy that I've heard with regards to the NCSBN ID is actually the VIN, a vehicle identification number.
Hmm.
So when a car is rolling off the assembly line, it is, stamped with that VIN, and that VIN follows is part of the car and follows it through the entire life. So when it's shipped to the dealership, every time a car is bought and sold, it's on the title, it's on the registration with the state. You add it to your insurance paperwork, so you get the repair history and everything like that. That identifier is tied to that car, and it is connecting all these different data sets and systems around the life of that car. And um, it's publicly available. You can walk up to any car and you can look through the front windshield and down in the dashboard, and you can see that VIN. So it's very
Mhm.
similar in that way to the NCSBN ID, where it's this public identifier, it's a simple number, and it follows the nurse from the beginning of their career in nursing with the examination, through their entire work history, and through the entire life cycle of all the different licenses that they may have.
Gotcha, very interesting. I like the comparison to a VIN number. I think that frames it, in a way that makes a lot of sense. So, what are some of the benefits of having an NCSBN ID number attached to nurses throughout the workforce? Jason, if you wanna start this one.
Yeah, definitely. I also just want to add, if it's okay,
Absolutely.
I know when I talk to people about NCSB and ID, a lot of times the most common reaction I get is, so nurses didn't already have that before,
Mhm,
and it really is true, right? I mean, if you think about it, the only analog, I suppose, would be SSN, but that comes with a lot of baggage. Sometimes people say, what about the NPI? And that's something that only about 2% of nurses have. So
mhm,
this was really filling a need that nothing else was really filling before. Now, in terms of benefits, there's, again, it sort of depends who you are and what you want to do. One of the things I'm excited about is the use by education programs. So, for example, we work with Dr. Susan Alexander at University of Alabama in Huntsville, and
mhm,
one of the things that they're doing there is really a couple things. Number one, for their graduate students, using NCSBN ID to ensure that those graduate students are maintaining active, current, valid nursing licenses. But number two, after these graduates leave them, really tracking their success and their career pathways and other things. So, for example, with the NCSBN ID, it's possible for an education program to know what percent of, let's say, our RN grads are going on to become APRNs, or
mhm,
what areas of the workforce are they ending up in, right? And as we know, there are shortages in a lot of different areas of the workforce. So we can even evaluate an educational program and say, well, are there areas of need out there in the workforce that we are not sending too many people into? Do we want to
mhm,
tweak our program to add more value to the community? So that would certainly be one way. I would say in more of a clinical setting, one of the use cases that folks are looking at is really quantifying the value or the contribution of nursing care. Right. This is something that there's a lot of active efforts around right now. But one
mhm,
of the problems is that as nurses sort of touch and do different things in the clinical setting, there's data captured, but a lot of times it's captured in different systems that can't really talk to each other.
mhm,
They don't have
mhm,
a very convenient or easy way to say, oh, the nurse who did this over in this system is the same person as the nurse who did this in this system. So
mhm,
the phrase we use for that is interoperability, right? With NCSB and ID, multiple systems can talk to each other, multiple data sets can be exchanged, but there's no personally identifying information that needs to travel. You can picture if all of these handoffs involved something like social security numbers, right? That would be a formula for certain things to go wrong, right? Or
mhm. Yeah.
privacy issues, confidentiality. But in terms of quantifying the value of nursing care, if you use NCSB and ID, you're able to aggregate data from all these different sources without worrying at all about PII.
Absolutely. And Matt, what are your thoughts?
Yeah, I mean, I agree with everything that Jason has said. I think he, stated the case around privacy very well, and really the power of the NCSB and ID is really that interoperability.
Absolutely. And just to follow up, obviously this would benefit, like you're saying, like, the aggregation of data all into one place. So, what are some of the use, like, how do you interpret that data? Like, what are some of the ways that could benefit the workforce with like having all of this new data in one place, kind of on a silver platter? If Matt, you want to start.
So, um, you know, NCSBN, being a membership organization made up of state boards of nursing, we, kind of exist in that regulatory space. And
Hmm.
what we've seen so far is that it's really helped with the process of screening and verifying um, nurse licenses.
Hmm.
So, hospital systems, staffing agencies, credentialing vendors, um, any number of different institutions have been able to leverage the NCSBN ID to screen applicants, verify nurse licenses, and then through different tools continue to monitor those licenses and make sure that the nurse is keeping their credentials up to date, and they're not subject to any disciplinary issues, for example.
Hmm. Absolutely. And I wanted to ask specifically because our audience here at Health Leaders, for my pillar, we talk to CNOs and nurse leaders all the time. So how can CNOs specifically, and health systems in general, use the number to kind of track their nurse's career? And what are some of the benefits there? If you want to start, Jason.
Sure. Yeah. So I already mentioned essentially the value or contribution of nursing care by nurse or by their nurses in the aggregate, but also in terms of quality improvement or training can be helpful as well, because if you're
Hmm.
able to link the care provided by a specific nurse to particular outcomes over time, what you may find is okay, this nurse is having more success than others. Are there things that this nurse is doing where we can provide training to other nurses, or perhaps if the outcomes are worse than average, right? Is
Hmm.
there remediation or professional development needed to sort of bring things on par with expectations? And so these are things that are very difficult to do today if everything that the nurse does and everything that the nurse touches over the course of the day or over the course of the week lives in five different places and isn't really connected. But with
Hmm.
NCSNID, at least the potential is there then to really get that full picture and then
Hmm.
use that to improve ultimately patient outcomes.
Absolutely. And Matt, do you have anything to add?
Yeah, I think the use of the NCSBN ID within the clinical setting is certainly evolving. We're working with several organizations such as HIMSS and the Alliance for Nursing Informatics to promote its adoption in the clinical technology space, electronic health records, et cetera, in order to leverage that interoperability that it offers. There was a study done by Dr. Kelly Eldridge at the nonprofit Center for Medical Interoperability.
Hmm.
They developed a model to explore how the ID could link data between devices and practitioners in order to align, nursing skills with patient needs. So I think
Hmm.
that study kind of really highlighted the powerful potential of the ID in a clinical setting.
Absolutely. And talk to me a little bit more about that. What was kind of the outcome of that study?
Um, what they looked at, I think they were looking at specifically they mocked up medical devices in the critical care environment, and then they kind of created a digital wallet of the person's skills, such as chest compressions. Could they deliver those compressions at the right rate and the right depth? And then they explored how data associated with medical devices and the performance of the resuscitation team. They use that to evaluate the performance in managing cardiac events, and they were able to
Hmm.
collect a lot of data and create kind of a dashboard in order to um, evaluate and again match. Do we have the right nurse? Do we have the right practitioner responding to the right situations in order to get the best possible outcome for the patient? And the NCSBN ID in this model was used as a kind of a common thread connecting all the pieces of data, with the clinician and the various medical devices that were part of the study.
Absolutely, yeah. That seems like very beneficial, especially, I think that piece you mentioned about assigning the right nurse with the right credentials to the right kind of emergency situation or clinical setting. That's very critical and key. Um, so I also wanted to ask, other than, obviously being able to track nurse credentialing and careers and their skill sets, what are some of the other potential applications of the NCSBN ID number? I know there's been a lot of talk about the value of nursing and how to demonstrate that, and I think this is a great way of doing that. So I just wanted to hear your thoughts a little bit more on that. Jason, if you want to get us started.
Yeah, absolutely. Demonstrating, documenting the value of nursing, I think, really begins with NCSB and ID because, again, so many of the nurses' contributions live in different systems.
Hmm.
And so this is a way to link all of it. I'll also add that there's value to the consumer. So, for
Hmm.
example, let's say that I'm a patient and I go back home and I want to learn more about maybe the nurses that treated me.
Hmm.
Sort of the typical way, the typical approach, and this is something that not all consumers know, but they should know. But the typical approach is to go to the state license lookup portal, type
Hmm.
in a name, for example, see what comes up. And of course, with some names, you're going to get multiple results, and then good luck, right? You might have to guess or
Hmm.
find ways to
Yeah.
narrow it down. But the idea is, assuming you're correct, right, you'll pull up essentially that nurse's history in your state. And what we know is that that's an incomplete record for many nurses
Mm.
because, of course,
Mhm.
they have histories in a lot of different states, or they have histories within the state under a different license type. For example, maybe LVN prior to RN or
Mhm.
concurrent. So, at any rate, with NCSBN ID, right, and we will provide that in the nurses database, we will give you the NCSBN ID if you put in enough other information to identify the nurse. With NCSBN ID, you literally bring up all on one screen the nurse's full history because, like Matt said, this number follows the nurse for life across jurisdictions and across licenses. And now all of
Mhm.
a sudden, what I'm able to see is okay, well, here in Illinois, I suppose things look pretty clean. They've been licensed for the last 6 years, but prior to that in Nevada, there was this issue, and I can read about it. I can pull up the documentation on it, right? Well, hopefully, what
Mhm.
you find is that there are no issues, but the point is, if there are, you're happy to find them. And you generally are not going to find that just going to the state license lookup portal, which I think is still where many consumers go. So through nurses and through the NCSBN ID, we really improve upon the transparency of nursing care to the public, to consumers as well.
Mhm. Absolutely. Yeah, it's almost like, I don't know if y'all have heard of this, but there's like a site called like Rate My Professor for college students, and it almost kind of feels like that, which I think is really cool. So, yeah, Matt, do you have anything to add as well?
I think, kind of going back to the interoperability. I know we keep talking about it, but it really kind of is the um, best feature of the ID.
Mhm.
Is in we NCSBN in 2022 had a groundbreaking workforce study, and it's been much publicized. Talking about the especially after COVID, the number of nurses that were looking to leave the workforce in the coming years, and there's been a lot of discussion about do we have enough nurses, and if we do, are they deployed to the right places? And so there's a lot of studying going on. Regarding the nursing workforce and aging and where they're coming from, and I think that again, if the NCSB NID is included in those data sets, it would allow researchers to kind of tie those different data sets together and do really quality research on, what does our nursing workforce look like? What nurses do we have? Are they in the right places? What are things that um, the healthcare industry or government needs to do to promote nursing or nursing education. So there's a lot of research going on in that area, and the NCSB ID can obviously be used to help researchers tie together different data sets and get those results so that we can make sure that we have a solid nursing workforce in the future.
Absolutely. Well, I'm very excited to see the outcomes of the NCSBN ID. I think it's a really innovative concept. Yeah, and thank you both so much for your time. I'm really grateful to have had this opportunity to hear your insights, and thank you so much to our audience for listening.